Good afternoon and welcome back. I hope you could actually make a break. We are restarting our marathon on EMDR and the pandemic's 10 months of interventions. Throughout this morning, we worked on hospitals, doctors, nurses, health workers, and so on. Then we passed on to the administrative world, the dialogue of the EMDR Association in supporting municipal authorities and those facilities that you do not immediately think about when we think about EMDR, but which give us our own life regulations. Now, in the afternoon session we are about to start, we will deep dive into two more worlds, nursing homes and schools. Two sectors that were strongly impacted. Nursing homes were also in the very center of newspaper news, also because quite often at the beginning, we made mistakes in treating COVID positive patients, thus spreading infection, which actually then became very dangerous also for the operators who were working with them within the nursing homes. In schools, instead, the debate is still open. Our children, teenagers, are paying their own part to COVID-19. We have with us two experts from EMDR Italy, and they have both taken up these two sectors. Let's start with Elisa Faretta, and let's talk about nursing homes. Dr. Faretta, how have EMDR psychotherapists helped nursing homes staff and patients? So not only patients, but particularly in our case, those who help the staff in the nursing homes, those who are helping our elderlies. Dr. Faretta, the floor for you. Well, first, good afternoon, everyone. Thanks for your time and thanks for following this very important event for all of us. For sure, one of the fields and the communities that were mostly impacted were nursing homes, particularly those who live inside nursing homes. Particularly the EMDR Association intervened and realized projects, thus starting a number of planned interventions that actually were implemented with the staff, nursing home staff, because we know that acting during an emergency for sure means working for the whole community, but particularly, first and foremost, working for those who are taking care of people. The EMDR Association has worked first to make the staff in condition to cope with this traumatization, which came from the emerging continuous situation that strongly put them to test for the deaths that staff, families, and the elderly were victims to constantly and continuously. So as regards the first intervention, we mostly operated in contact with the operators, trying to foster answers for reactions for post-traumatic growth, resilience, becoming we and not only I within the community. So I think we can here get into the details of nursing homes in general. We know that nursing homes are residential institutions, facilities that accept elderly people who are vulnerable, who are fragile, and who need support not only during the pandemic, they always need it. The pandemic definitely complicated this general picture. The health emergency has involved and penetrated nursing homes like a tsunami, like a hurricane. It interrupted daily life and overwhelmed daily life our elderlies were used to, because this daily life, this routine, he provides safety, allowing them to feel fine and okay with their own caring staff. So EMDR interventions have allowed us to take care of the who caregivers who could better deal with this emergency. This is an iconic picture of the emergency, of the support that we had, that they had for physical contact, for a hug that was not always possible. In staff, this brought to a response in terms of compassion fatigue in a situation in which EMDR interventions allowed to reprocess the most traumatic events related to the emergency within nursing homes. Usually, EMDR emergency interventions are focused to prevent psychopathological disorders following stress, trauma, to prevent them from happening, to prevent them from becoming chronic. But we are also talking about acute stress, vicarious traumatization, psychosomatic disorders, insomnia, and many more disorders. This allowed us to stimulate the ability to cope with the emergency. Particularly, the interventions realized thanks to the support of many EMDR therapists, allowed us to work on healthcare workers first, but also on family members who were also victims to this pandemic. The elderly is living in the facilities and the new admissions that are always present. We realized our intervention, as we saw very well this morning from my colleagues' interventions, who gave much room to specifying how technical modalities were used within the scope of the different emergencies. And practically, EMDR is used specifically with online group interventions, small groups. Usually they include 3 to maximum 5 people, and they are implemented from 3 to 5 sessions if necessary for each single group. However, let's have a look at the critical points that were visible and which we had to cope with. I would like to describe this for both operators, the elderlies, and the staff. As Luperi said, one of the first critical issues were the deaths, the impossibility to say farewell to the people who were dying. This has been a great trauma for both operators and families, and also for the very same elderly who saw their facility mates die really in front of their eyes. We know that residential care facilities are communities that generate very important connections, affective connections, because the community is like a family. So, attunement, empathy are very important. Hence, the operators had to cope with these losses that have realized in the terrible ways we have all witnessed, and isolation or self-isolation for the people in the staff were some of the toughest problems, and also exhausting shifts, fatigue, not being able to take care of the people. Some operators referred they were crying both during their shift and even at home. So the work with EMDR made it possible to rebuild the group, to valorize it as a safe place where to express emotions, where to process the most difficult moments, where we can share our fear because it's human. This provided more strength and allowed us to think we are a unity that can make it. Of course, critical events were so many. For the operators, it was the difficulty of seeing them breathe with difficulty, witnessing their farewell without touching them, running from one room to another, lack of space for the corpses and the mortuary. A really dramatic situation. And even lingering on these painful events, well, this is a way to share with you what this community has experienced, thus picking the events that were processed with us. For us EMDR operators, these are targets to be reprocessed and metabolized. Many operators had to isolate themselves so that they would not infect their families or the elderlies. Hence, they have lived an experience in hotel rooms, trying to keep some distance if they were to go back to their homes, hence with lots of consequences for their families too. The very same elderlies experienced very traumatic events that mostly relate to powerlessness against what was happening, not being able to see their own relatives, knowing that if they had contracted COVID, they might not see them anymore, not being able to bid farewell. This was one of the most important events we have reprocessed, and guilt and responsibility that the relatives felt because they could not be close to their loved ones. So the feeling of being lost, helplessness, sense of danger, this was all processed also with the families that, as I said before, felt guilt, anger, the concern for maybe not being recognized anymore after much time, because we know that for the elderlies, contact, human contact is paramount. Solitude is very important for everyone, but even more for the elderlies. If an elderly person loses contact, he or she loses cognitive abilities. Hence, critical events were so many. So let's now see how we have coped this situation as EMDR Association, how we coped with this trauma, how we responded to the communities of operators, families, and elderlies, thus fostering post-traumatic growth. First, the facilities were a lot, 22, as you can see here. We've been active in many regions, Basilicata, Lombardy, several facilities in Lombardy, but also Sardinia, Liguria, Piedmont, Trentino, the area of Reggio Emilia, then again Liguria here. Many nursing homes actually asked for and formalized their convention with EMDR Italy, and many are actually adding up now because unfortunately we are experiencing the second wave and we are not at the end of it. So as we saw this morning, the convention with the nursing homes was formalized. Many EMDR psychologists actually provided their collaboration, and these therapists were always monitored, trained, always constantly by our colleagues, particularly those who worked on that, Jada Maslovac, and also Stefania Sacchezzini and others who actually collaborated and contributed a lot. In collaboration with the association, therapists have always been connected to what was happening and they were supported. Of course, we have used the EMDR group protocol, updated, of course, and adjusted to the specific characters of this intervention. This is what we did during each intervention. I'll be quite quick on that because I know and I heard this morning what my colleagues already shared with you in the morning. However, these are all technical figures and data that make a difference because as usual, working in emergency context means that we are trained operators, not just there by a chance. We must match an evidence-based skill as the EMDR approach is during an emergency. And this fosters a humanized treatment. This is paramount. Hence, we have shared a project. We have provided psychoeducational material you've seen in the morning. And we have acted scientifically by providing an assessment before the intervention and thus adopting a system to see whether interventions could really be beneficial. Hence, with the IES scale, as we saw this morning, the emotions thermometer, and we then saw how all these interventions provided post-traumatic growth in the people. As we said, the intervention was performed with 3 to 5 group EMDR sessions, and the people in each group were from 2 to 5 to reprocess those disturbing experiences that were listed before as regards the critical issues and to strengthen resources. In some cases, we also needed some individual interventions. Now, I would like to share with you the first video from a nurse, Marta, who is telling us about her experience and the effects that the EMDR intervention had on her. Good morning, I'm Rita. I'm 55 years old. I'm a nurse. I work in a nursing home in Valseriana, province of Bergamo. The worst period during the pandemic started at the end of February, when many of our residents actually fell ill and died. For me, the guests at the nursing home were like my family. I almost saw them every day. I had known them for years, and I knew their families. They were days of great suffering. Every time the conditions of a patient actually worsened, I felt powerless, defeated. I remember silent crying with my colleagues, but we had to go on with our own work. Coming back home, the anxiety of the situation prevented me from sleeping. I myself fell ill. I had the first symptoms in mid March. The tests then showed I had been affected by interstitial bilateral pneumonia, and a few days later I got the positive result from my test. Then I was contacted by Dr. Marinoni, who explained the EMDR method to me, relieving experiencing the death of people I loved was not easy, but thanks to the people who were working with me, I was able to put together the pieces of what I had experienced. So I was able to share my dramatic situation. I learned to work on my memories thanks to the EMDR technique, focusing on the images that had made me feel worse. After psychotherapy, I now can relieve those moments without the negative feeling that was with me before. So I want to thank all the people, all the professionals who are using EMDR. Enjoy the day. So thanks, Rita, this nurse who shared her experience with us and how the experience through the EMDR approach allowed her to put together the pieces of her life and to go on. Let's now get into the heart of our experience and projects. I chose to this purpose some nursing homes, some facilities. Of course, I would have plenty of material to share. Of course, we had to make a selection. So now we will talk about these structures in the area of Trentino, three facilities, particularly in Storo, Strada, and Sondino. These facilities host 190 elderly people divided into different types of typologies, self-sufficient with low care needs, some others with psychiatric problems or partially self-sufficient, not self-sufficient at cognitive and physical level, partially dependent and with fair cognitive function, elderly people with Alzheimer's disease. So here we see what intervention all EMDR therapists fostered in these facilities. First, we had to redevelop the spaces to help the people cope with the risks and the infection. As in all other projects, we had a request for activation of the psychological EMDR intervention by fostering the activation for a specific period of time, but it is still underway. Particularly, as we saw this morning, the project, distant, however so close, was very important for managing deaths, for the families of the deceased elderly. We sent personalized letters to the families, and thus we help them feel close through phone consultation. Let's see how this attention to being close in such a terrible moment in life allowed somehow to help them. And we see that here in this letter. which is personalized, as you can see. Dear family, we will always remember your dad, Honorio or Mario or whatever, because thanks to his happy and playful character, he used to entertain guests and operators. Every morning he was waiting for the postman to receive the newspaper, and then he brought it to the entertainment room so that also the other residents could read it, because he participated in the trips we offered with great enthusiasm, and particularly because his presence in our facility has exerted a very positive influence on the guests and operators' mood. I really wanted to read this letter, which is very touching, but this really lets us attune into this project. Here, we are getting very close, and let's see how we structured our online group EMDR sessions. The online group went through specific intervention phases that are very well organized and that responded to criteria and phases that had been agreed in the group EMDR protocol. Here are a few items regarding diffusing, that is the modality to lower the level of activation, to stabilize EMDR on the most distressing, disturbing event, resource installation, both at individual and group level, and what we call the body scan, hence the possibility to free the body too. Second session, second meeting, the safe place, Google search. These are all very technical modalities, so I will not linger on that because you've already heard about them. However, this is only to focus on how each session was specific according to very specific technical modalities with a specific goal. The third meeting, all these meetings actually considered specific targets. The targets are those images that are marked, impressed in the mind of the people exposed to trauma. They are traumatic, and if not reprocessed, they keep on coming back through intrusive thoughts, flashbacks, the possibility to develop a number of consequences. I'll read only through a few of them because I don't want to take too much time. The world had been turned upside down. There was no routine anymore. All spaces had been totally changed. And this is very important for nursing home residents. The first time I got covered from head to toe and I didn't know how to do it. Seeing people die in your own arms, the tragic deaths of the residents, other images. One guest found it difficult to breathe. A colleague was tested COVID positive, participating in the residents' video calls with the relatives and so on. These are just examples, but as we said at the beginning, these are connected to the critical issues, to those moments that, if not reprocessed, if not shared and metabolized, they can remain stuck in the neural networks of all the people, and they do not allow what we would like to have instead, that is the activation of our resources, the coping resources, and the general personal and collective well-being. Negative cognitions, if you know EMDR, these are those thoughts that are connected to the most traumatic images. Quite often these beliefs are connected to danger. I'm in danger, I cannot trust, I'm helpless, I have no control. On the other side, the possibility to go towards resolving, to go towards a higher ability to cope with my resources. I can deal with it, I can do something, I'm healthy. This allowed to strengthen individual and also collective resources. These are examples. I have a team and my loved ones. I'm capable and strong. I can do it, stay in it, improve the situation, and manage it also by asking for help. The major emotions we've seen are linked to these ones: fear, anger, terror, sadness, pain, regret, frustration. And these, of course, also involve the body, with physical problems to the body, the back, the eyes, the stomach, and so on. So working with EMDR allowed us to work on resources, and these were some of the aspects that emerged after intervention. Patience in helping colleagues, being part of a work team, collaboration, humbleness in accepting help, humanity, togetherness, sharing, closeness, solidarity, support. These are much different from those critical aspects we have seen. So, this developing resources, seeing that we can do something with a sense of control where possible, we can keep safe, calm, enjoying life and what it gives us. This was a major result. This was a major possibility for us to go on together. And here we can see that pretty well. Again, these pictures from these facilities in the Trentino region, they were very generous because they provided us with this material. So we really want to thank them. They have restarted enjoying their common spaces. This is the main room with the guests who have restarted sharing, even though they are distant, and visits a relative visiting an elderly resident, even though with a glass in the middle, and also the collaboration, the work these elderlies can do, like, counting the face masks, distributing them, participating, sharing. You see here, they are just doing something, providing a new sense to their life and to what was happening. Hence, post-traumatic growth, which was also validated by the scales I was talking about before. So the safe place was one of the most used techniques by the operators to feel they were safe, they could do it, and that was also extended to the families. Here we have a few figures. Of course, I won't get into the details, but this is just to show how we have worked. This is the IES scale. We see the results from the beginning: intrusiveness, avoidance, hyperarousal. They have all dropped throughout the 3 facilities, as you see. Here, how many subjects we treated in these facilities. We have worked with healthcare workers, professional nurses, physiotherapists, entertainers, doctors, nurse coordinators, administrative personnel, and volunteers. You see here the amounts, the count, the number of interventions: 37 people in Strada with 13 groups, 39 group sessions, 1 individual session. In store, 47 people, 19 groups. Condino, 42 people, 15 groups or 45 group sessions, totaling 126 operators, 47 groups, 134 group sessions, 21 individual sessions. Sorry for these figures. I know they can be boring and repetitive, but this demonstrates the amount of work that we have completed in these three communities as in all other communities. So we can actually extend these figures and see what impact our intervention has had. Let's now see the experience of the nurse coordinator at the Trentino facilities. The second video, please. Good morning. We are in Borgo Chiesa, Trentino. I work at the nursing home Rosa dei Venti. I'm a psychologist. And I'm here with a colleague of mine. Today, we would like to share very briefly why we asked for the help of EMDR Italy during this pandemic. Well, in March, we were overwhelmed by the pandemic. After a tough beginning, after the continuation of this period, we believed it was necessary to require for support for our facility, the staff, and the guests. Thus, we wrote to EMDR Italy and to Isabel Fernandez, and we asked for support. We received resources from all over Italy. Meetings took place online in small groups, 3 or 4 people each. What did we learn? We learned where the safe place is, and they provided us with a tool to work at home too. Either when we were quite oppressed and stressed, or in general, because that was a tool to feel better. The safe place but that was not only a resource for the moment, it was also very important in general in our life. Yes, the safe place then, and also the fact of sharing with others, and the fact that we were not alone in feeling those situations, the stress, and so on. It was a very important moment. As at today, we have believed it was important to accept the request by our staff, that is to restart the sessions, because they were a great support for all of us during the worst moments. So thank you, really. I think we all want to greet all the colleagues and also thank them. Yes, personally, I want to thank you all for your availability and for your support, because it was really, really paramount. So thanks to the colleagues, thanks to EMDR Italy, and enjoy the day. Well, we have listened to the testimony and we have understood that we need to go on with our interventions in the facilities. They are much required for prevention purposes. You see here, again, group work, which is returning resources to the group. It's an image of solidarity and mutual support that represents the connection between the earth and the sky. Now, the nursing home in Telegonia, here, the situation of this nursing home is quite peculiar because nurses and health workers, the new heroes, self-isolated themselves for a long time so that they would not infect their own families. So they say, we'll stay with our guests for the whole month, but if required, we can go on with this measure even longer, an operator says. The facility is a high quality integrated residence for elderly people located in the metropolitan city of Cagliari. This facility meets the needs of elderlies, different kinds of needs. Of course, very quickly, the methodology has always been the same. The online EMDR group with short cycles, 3 sessions each in groups from 2 to 5 people in the group. However, what I would like to read with you is what the director of the home told us. The most critical moment, we had to close our gates to visitors. It was the hardest moment for 2 reasons. The first is linked to the gradual and inexorable realization of how serious the situation was. The second is directly connected to the fact that we felt denatured and deprived of one of our cornerstones, one of our safe places, the constant presence of our residents' families. In fact, in our working philosophy, family members are a constant presence and a great resource which we still have to do without. What did we learn? The director of the nursing home in Telegonia says, group strength, having experienced such a long and intense period, sharing everything in an intense and strong way, every moment of our day has allowed the group to create a sense of we so much bigger and so much stronger than me. This is the greatest treasure that a working group can achieve, particularly when people taking care of others are involved. The we that protects, stimulates, and unites. What have we gained with EMDR interventions? They have helped a lot reprocess critical moments and put them together, connect. It has allowed everyone to recognize themselves in their tiredness, in nostalgia for the loved ones, without feeling less important, less efficient. It gave voice to each person's weaknesses and turned them into a resource. One of our collaborators compared EMDR meetings to the work of the silk spinner. Each thread alone would break under the pressure of work and personal dynamics. The EMDR work has joined the single threads and made them one that is strong, tenacious, and resistant. I think these words are really very important. This is the thank you letter from the nursing home, and these are pictures of the people. But I would like to conclude in my final comments before leaving the floor to our moderator. So these comments, which are paramount for me, nursing homes are and remain a community within a community, often forgotten. Yes, true, they are often forgotten, but they have come under the spotlight when the COVID emergency broke out, an epidemic that mainly affected the elderly. With existing diseases, we knew the virus would hit this population particularly. We can learn from this. This is a fact. The EMDR interventions must go on to promote new resources. So we have to be born again from every crisis. We must get a new lease of life from every crisis. We must rise again, and even more so from this devastating experience. It is essential that we begin again to promote personal collective empowerment. So let's go on. And now I think that my last communication is that of gratitude for everyone who has worked in these projects. You know, you are a lot. Therapists, it is impossible to list you all, but you all have a great heart. We can do great things when there is great passion and great energy, and only this passion can generate an absolutely different kind of light within ourselves and in the world. So really thanks to all EMDR therapists who made this all possible. And thank you to such a generous association. All alone we can do so little, together we can do so much. Thank you. And with this, I conclude my intervention, hoping I was really, I was understanded, and even though short in my intervention. Dr. Faretta, I don't think that being short or understood could describe your speech. In a couple of moments, you moved us. So we want to thank you because you really paved a way for all of us to understand how the future can be. And this is something we all have to reflect on. So, special thank you on my side because I really felt some emotion. We cannot stop. We have a lot to say on EMDR interventions during the pandemic, which has not come to an end. The pandemic is actually going on, unfortunately, but those who are also paying a very high price are our youth. They have very different situations, but they all have to do something. And even though the next Christmas holidays will be very short and quick, we are all wondering what's going to happen on January the 7th. Are schools opening again? What's the future for our children? During the first phase of the pandemic, everyone was blocked at home. All schools blocked. Now only high school students are following school from home. But what happened in there? How did school children react to the pandemic? And we are thus involving Dr. Caterina Paturzo on that. Good morning. What can you tell about us? Well, good evening, Federico. Very pleased to be here. Thanks to our studies, we will see within short what we can say is that children from 3 to 18 years of age for sure have suffered from negative consequences, particularly as regards the lockdown, the impossibility in the first period to go to school and to attend lessons in presence. We'll see in the details. However, children are suffering a lot for this second wave too. I would like to ask you another question. Two things, actually. The relational aspect of our children's life has been interrupted and then moved to screen modalities because they started using technological devices much more. So what's happening in terms of growth? Because they were experiencing this all in paramount moments when they develop their own personality, and they must do without the presence of their peers. And if our children have any frailties, what's this in this sense? Well, first, let's divide this answer in terms of age brackets. Because if we talk about younger children, 3 to 10 years of age, they learn a lot also through their relationship to the peers. The absence of in-presence school brought to a behavioral effect and also to uh, coming back in terms of other acquired competencies. As for teenagers, instead, our children had to get used to remote school through the tools that they were perfectly able to use, but which school was not that used to at the beginning. We were not ready, probably. So, during the very first months during the pandemic, there was a full reorganization regarding schooling lessons. Our adolescents, the teenagers that are used to having peers around in an age bracket when peers are even more important than parents from that some point of view, well, this is a problem. The absence of this continuous confrontation children had an impact in terms of isolation and the fact of using technological electronic devices for so long. Well, this has created more addiction, let's say, on the use of electronic devices, in some cases, thus even removing an adolescent's creative side. However, let's go one step ahead. In hospitals, we talked this morning about patients, but also about the problems linked to health operators in general. Within the municipalities, we talked about anxiety and anguish, stress for the administrators. In nursing homes, again, we talked about health operators, entertainers, doctors, and so on. Is there a COVID problem? We have to intervene with EMDR on with the teachers. Well, the work we've done was on several levels, because for sure, working with the school in the province of Bergamo, where COVID has also touched on the fabric of the teachers, the families, the colleagues. But not only that, also at personal level. When we talk about school interventions, we mean several levels. Victims are first type, because we are all victims of this pandemic. Also teachers, students, parents, and all the school workers. At the same time, we also had some situations, and we have worked with some teachers, maybe older ones, who were afraid of getting back to school in September because they feared infections. And in that case, we had structured some interventions with group EMDR, right, to help those teachers to let traumatization go connected to the fear for coming back to school, because, of course, based on their age, the fear for infection was much stronger, since they were actually approaching the date when they would have to do with children, which was very scary for them at the time. So for sure, this level is something we have dealt with, but also the other level, the one of the lockdown, isolation, from also the relational point of view for the teachers. Many teachers in our psychoeducational meetings told us that they felt difficulty in not being able to physically come close to their students, their pupils, first year elementary school children, for instance. The difficulty of not being able to physically come close to them, well, that was one of the situations that were most reported during our meetings. And they were very clever, because in that post-traumatic group, we also found new creative modalities to approach the children, the pupils, while keeping the own professionalism and specificity. Well, great, but we do not know exactly what's in our future. Are we out of the second wave? Will we have a third wave or not? I believe that without oversimplifying, the best practices to support a school of any age brackets have been identified. If we had to tackle another wave, we would know what we could do. Actually, the members of the EMDR Association may know that I can just support you. But if we try and be optimistic, 1 month later, after the pandemic, what should we do to solve what we have experienced, to rebuild what was injured? What's in post-pandemic terms, in EMDR terms, in the school field? Well, post-pandemic is the present, actually, because this work nowadays is connected to reprocessing the experiences in the present. Because we do not only deal with the children from a psychoeducational point of view, we all help the students to reprocess their own intrapsychic experience as regards this critical event. And we know that when we allow this reprocessing to happen during the very same pandemic in our case, this is laying the foundations for prevention. If I reprocess very quickly, either during or immediately after, later it's going to be much easier. So what we do today is preventive activity for the future, right? Because after the pandemic, we can be back to having children who have already reprocessed and who during the pandemic have received a number of strategies that will allow them after the pandemic to be back to ordinary life, as they are actually trying to do now. Because particularly in this second wave, schools were not all totally closed. We know that up to 11 years of age, they have never stopped, unless, of course, any infected positive cases were found in the schools, so they had 15 days of precautionary quarantine. So they were used to go in and out from this lockdown presence mechanism, and this allows them to improve their adaptation. It seems strange, absurd, but really children and teenagers have very, very strong resilience skills compared to the ones for the adults. Yes, actually, they are very young, but they are also very skilled, so they are not really nice. They are lucky from that point of view. But apart from any jokes, of course, I am outside your experiences, of course. I'm an outsider. So I was impressed by what your colleagues said. That is, people who are not usually working within the field of health, like municipalities, have often and easily understood that they needed external support. Was it the same also for the schools, for the different school districts? Was it the same? What about the cases you have experienced? Can you share maybe some of your experience? Were you offering your own intervention? Were schools contacting you? So how are you activated? Well, different modalities come in. Sometimes the therapists from the EMDR Association actually were already working within some schools and they shared our project. Other times, the schools had already come to know the association because maybe they had already contacted us for other critical events. In general, the schools we have worked with were schools schools found it quite difficult. I'm talking about March, April, and May, the first lockdown. The normal situation was to understand how they could set up remote lessons. But in July, they already knew they would have a different situation. It was not a normal after holidays come back to school. And there was much opening both on the teacher's side and on the parents' side, because we have worked not only with the school as an institution, so with the teachers, but also with the students and the parents. If we have no other questions, I can introduce my presentation. Our project is actually a project in collaboration with the Ministry of Education that asked us to be involved since last May. And the consequences we talked about before are consequences that consider post-traumatic effect due to irritability, isolation, and sleep disorders. These are the three macro problems that we have witnessed transversally throughout all school ages. We have used, from a conceptualization point of view, as I said at the beginning, the results from Gaslini Hospital in Genoa. We worked on 6,800 subjects that provided us with a lot of figures to work on. And this stated that 70% of Italian children and young people have experienced a regression during the lockdown in one or more aspects of their lives, even in those children in younger age. The main characteristics were related to behavioral regressions and not only to irritability, while for teenagers, the characterization we were talking about before, in addition to isolation, the use of technological devices in an improper way, we also assisted to anxiety disorders that were heading towards panic attack disorders, hence psychosomatic disorders. The targets of our interventions, as we said before, were school at all levels nationwide, involving specific intervention tools like psychoeducational meetings for the teachers and the parents, groups with EMDR protocol in presence when possible, because in September and October we were also able to work in presence until the law allowed us to, of course, and psychoeducational meetings for teachers and individual support for children bereaved by COVID-19, as we said before. What was really very important within these psychoeducational meetings for teachers was particularly the double focus. So the focus on the children, on the student, providing the teachers with all those conceptualizations that could teach them to recognize a PTSD caused not only by exposure to COVID, but also by the lockdown and the isolation, but also on a focus on themselves as caregivers. Our children spend 8 hours a day with these adults, and we know that the adults' well-being cascades in effect onto the children. So we have tried to help teachers recognize their own stress levels too, not only the stress levels in their students. We provided indication on how to distinguish fear, phobia, anxiety, panic, to understand how quickly to help if something happened in the class. We focused also on how to facilitate learning with teachers. We clearly stated what we usually say during an emergency, that is, the children's brain against a critical event is processing that traumatization. It has not enough energy to concentrate on learning as if they were free from that traumatization. This was what the teachers had to consider to calibrate their learning modality and ability, and in different times. We also provided strategies, useful strategies to come back after precautionary quarantine, to foster the adaptation between in and out the school walls. While in psychoeducational with parents, it was very important to focus on the children, of course, as for the teachers, also to focus on themselves. Parents as a reference point and an attachment figure. We have tried to let them understand how being victims of the first type of this pandemic could move the reaction in their children, and thus we have helped them find coping strategies and tools for emotional regulation for themselves and for their children, thus creating real protective factors and preventive factors for the children's growth. We have also explained to the parents about the quarantine material that Dr. Verardo actually created in the first part of the pandemic. You can use this material directly with your own children. We explained how to use that, how to create the climate to talk to them, and how to use this with them. We also went for some psychoeducation with the parents as regards the functioning of the adolescent brain, on those dynamics of exploration and affiliation, so that parents could get closer to the world of their adolescent children, that especially at this time makes children tend to be isolated. We provided specific support for each age group and also stimulated sharing personal experiences. We have done that through very clear questions, direct questions, where each parent could actually answer freely, even giving examples of what was happening in their own homes. And we found very high attention by these parents who turned to us and who accepted to take part in these meetings that their schools were offering. The important thing we have focused on was the strategies, the coping strategies, the resources that we can implement for myself and for my child. How am I relating to my child in this moment of a collective disaster? Because as we've heard in the morning, this was exactly the point. Now, how am I relating compared to what's happening? Trying to help those relations that during teenage are more distant. As for the interventions we have started, we've talked about EMDR group protocol with primary and secondary school children. I would like to show the example of the Zanica and Comune Nuovo schools in the province of Bergamo. Inside these facilities, we have worked a lot, very well, in synergy with the psycho-educational staff inside the schools that have created a very important psychological culture, and that have also helped us in the toughest moments when maybe it was not possible to access the school. So they had us relate to the students. So in addition to the psychoeducational meetings with parents and teachers, we also had some reprocessing groups in the primary school with the 3 first grade classes, and in the middle school with 6 first grade classes. Right, because the first class of both levels is always a moment of very thorny passage for children and adolescents. Work was structured as usual within the EMDR association through the administration of tests, because we always try to go for some research to have data in our hands, and then with the different group meetings, so 2 meetings with follow-up later. I will not get too long on that, because you know the procedures. These are our group protocol procedures, but I want to show you these examples. The first one, well, this is drawing from a girl in the first grade middle school year, when she is asked, what's the memory? What is the worst element for you in this COVID pandemic? And she writes here in quadrant A, it's not a dream, it's reality. As you see, the picture has some trucks in it, and probably those are the Bergamo trucks that were shown a lot during the first lockdown. So how the visual TV impact had a fallout, traumatic fallout on children too. We have some sadness and anger too, and then you go to the third quadrant. Okay, it's all very nice, we all stay at home, okay, but then there are people all around who don't wear their masks. Set after set with the butterflies hug, we got to a SAD equal to 0, hence total absence of disturbance. And the girl writes, despite all this, we do our best. We are back to our work, and schools are open. So an open school is a signal of rebirth. Second example, we find here the target episode, which is the fact that we had to attend classes online. This, again, first middle school year boy, he felt that it was most difficult for him to have to attend online classes. This evolves into sadness, a second quadrant. You see SAD from 6 to 7, so it increased. There's more disturbance. Why? Because I could not meet my friends. So in this reprocessing, we see everything. We see the difficulty of online learning, the sadness for isolation, and then the positive evolution. And now I can meet my friends, but following some rules. So how clever our children are, and how nice the drawing of the mask is. You see down at the bottom the virus fighting with the boys. There are also this bang bang. So the weapons I want to destroy, what is depriving me of my life. With a resolution, I think that things can get better. With a nice smile. You see, the drawing and the words let us understand what reprocessing path this young boy has followed. In this work, we have also provided good attention to post-traumatic growth, to the meeting on post-traumatic growth, when we asked the children to finish these sentences: I have, I am, I can. Everyone had to focus on the different sides of self, on the emotional aspect, identity, the positive cognition of the self, I can. This I can is very important because being able to take up again the own power as regards what's happening is a very important post-traumatic growth. Other colleagues today were mentioning how against a catastrophe like this, we cannot do that. And it is quite normal that in front of critical events, we feel powerless because there's something we cannot do. But for sure, we can act on what we are feeling. We can choose how we want to cope with what's happening. This a work in progress. However, we are working on this inside the school, and what is expected to be completed by the end of this work is putting together all the drawings in a single picture that is going to be shared on the class register. So we are using these tools we were not used to using to share this psychological aspect for parents to see them, to they can see how this works is completed in a more general view and sharing. We also worked on psychoeducational meetings for teachers and individual support for children bereaved by COVID-19 in a school in Cogliate, particularly, which is still, the support is still underway. We are having two major interventions, strategies for teachers regarding bereavement, and the second, which is the children's reprocessing of bereavement from March to now. What I would like to stress is the importance of these psychoeducational meetings for teachers regarding not only complex bereavement and bereavement in childhood, but also the peculiarities of COVID-19 bereavement. As Dr. Faretta was saying before, she was telling how these deaths have been characterized by isolation that do not allow for grieving to start. So we must provide attention to these deaths because children don't have the usual tools available that in other moments in their history can help them in separating from the deceased. We have also provided this support strategies to the teachers, not only for the child, but also for his or her class. So how to bring the whole class to reprocess. We know that children project a lot when something happens. The first fear in children is, and if it happened to me too? That's the very first question they ask themselves. So we have tried to help the classroom groups in this reprocessing. However, the whole group class was to be a support for the bereaved child. And of course, we supervised the teachers in constructing the project to be implemented in their own classes. As for this project in Cogliate, we decided to work individually with children, so no group support, but individual meetings, from 3 to 6 meetings with the protocol for recent traumatic events by EMDR in presence where possible. But particularly, we are using the book You Are Not Here Anymore and I Feel Down, which is a book we all EMDR therapists known by Verardo Rosso. They have always helped us in working with the children after emergencies. And of course, we will also have to do with some feedback to the child's parents to understand whether those parents have somehow reprocessed naturally or at least started their own grieving, or if they do require help too, because it is important to help children. But if parents are stuck in grief, in morning, then children will not be possible to reprocess it. So we really need a work at family level, a synergic work. And in these cases, I must say that the collaboration with the teachers that sometimes push some parents to treatment, well, that's very high and very good.
questa è un po' la
This
slide
is
che ho costruito per
the slide
farvi
I
vedere
have
un po'
created to show you
tutti i luoghi d'Italia dove
where
siamo
in
intervenuti con
Italy
le
we
scuole,
have
quindi
worked
norte
with
a sud,
schools, so
considerando
from
che
north to
comunque
south,
là
considering that for each
sono
city,
stati fatti più interventi.
more
Sono
interventions were made.
intervenuti, come dicevamo prima,
And as we said before,
dai nostri
interventions
colleghi,
were
dai
performed by
bambini
our
che ci
colleagues
conoscevano, in
with the
qualità
collaboration
da
of the
assessore
headmasters,
comuni
sometimes
che ci avevano
even by
conosciuti
the
dalla prima
councillors
fase
in some
pandemia, quando
municipalities that had
lavoravamo
already
con
worked with
comuni,
us in the first part
ad
of the
agosto e
pandemic when we
settembre
were
si
working
sono
with the
resi conto che il
municipalities.
loro
In
tessuto
August and
lavoratorio
September, they
di
understood that their social
supporto
fabric
anche
required
per
support
quelle scuole che in
for
qualche modo
schools too,
sembravano
those
quasi
schools that
dimenticate, no? I nostri
somehow
ragazzi.
seemed
Ci sono
blocked.
state molte polemiche,
There were
però
many
la
debates on that, but as a matter of
importante
fact, the
proprio di
construction
intervenire
strength
adesso in
was
maniera
to ask for help
specialistica.
specific in a specific and
Sicuramente
specialized way.
diciamo
Of
stamattina
course,
Isabel
this morning
parlava
Isabel
di grandissimi
talked
numeri che
about
abbiamo
the
raggiunto
numbers
e questo è avvenuto
that we
anche
have
nelle
attained, and
scuole
this has
e
also occurred
il
within
nostro progetto
schools.
continuerà
Our
ad andare
project is
avanti
going to
soprattutto l'anno
continue
scolastico
definitely throughout the
ed è
whole school
quello
year.
che supporta i colleghi EMDR
This is to support
attraverso
EMDR
il lavoro in
colleagues
rete, un lavoro di
through
rete
a
interno, ma
networking
questa è
activity
un'abitudine
inside the association. But this is an habit we have always had.
quotidiana e sempre
The
molto presente.
teamwork is
Quindi
always a
sono
winning work,
questi
and this is it
spot
actually.
proprio
This
tutti
brings
totalmente
us to
EMDR senza cui io
thanking
lavorare
all the
e collaborare
EMDR
e sicuramente con cui lavorerò ancora perché
psychotherapists I'm
contempla
working with, because requests
grazie al
keep on
personale
coming. And I also want to
classico
thank the school
ci ha
staff
affidato alla nostra
who have
professionalità,
relied on
ma
our
soprattutto all'attenzione
professionalism. But
ringhiera
particularly, I want
che
to
è
thank
proprio
the
scelta
EMDR
di rendere
Association
energia quelle
that
piccole barriere
chose
umane,
to
l'energia di
invest vital
psicologi
energy
EMDR che pensano, no, anche quando
in
entrano in classe
what
stanno
we are
facendo, stanno già
doing.
pensando al suo sviluppo, alla sua crescita post
Because
Covid
when
e
EMDR specialists
portare
work with children, they are
risultati
already thinking
positivi
about their future. This is a
e
vital
sono persone
energy
che nel
for the
mondo del
future of our
lavoro, del
country, and schools
sviluppo sono
are the
importanti
future
per
of our
questa
country.
generazione.
So it is very
Questa
important for this
ha
generation
reso possibile
to
mostrarci
have
da un punto di vista
the
interpsichico rispetto a tutto ciò
least
che sta accadendo.
consequences
Ho
at
cercato di
interpsychic
essere
level of
il
what is
più
happening.
veloce
I
possibile
tried to be as
dai
quick as
tempi
possible, to be
grazie a tutti
within the
voi.
timing I was assigned. I
Do la
want to
parola
thank you all. And of course, I
a
leave the
Federico.
floor to Federico. Thank you very much. Thank you for this analysis and this pathway. I would like to make one more observation with Dr. Paturzo. You are confirming that the approach of the EMDR people towards the school occurred in a very serene, not invasive way. You were able to start communication as if you had always worked
Siamo
together.
abituati alla
Yes, for
frase
sure, we are quite used to working like
sinergia
this
quanto
in
cura, non
synergy
avrebbe
with
senso
the facility.
opporsi, anzi il
Otherwise,
lavoro
it
di
would be
squadra
nonsense to oppose it.
prima è sempre
Teamwork, as I
il
said
lavoro
before,
individuale,
is always the
dalle
best work to
dirigenti,
go for.
insegnanti
So,
agli
from
psicologi,
the
è un lavoro
managers, the
coordinativo in
psychologists,
territori complessi. Questo è stato molto
therapists,
importante
psychologists,
perché
everyone played a major
collaborare
role,
per
because
riuscire
working
a riuscire
together
a
with
fare
in
anche
house staff
un'analisi
means that we
specifica
can
di un
produce a
testo
specific
complesso come il
punctual
nostro è
analysis of
molto
needs school after school.
standardizzato, ma
Ours
anche
is a
perché si
standardized approach, but
applica a
only
protocolli
because it
che
relies
funzionano
on protocols that work and that have been used for over 20 years now. However, all of them within a context, thanks to this analysis of needs and contextualization, because as we were saying before, a school in Nembro cannot be the same as a school in Assisi. Now, for instance, this is very important to stress, and we have always had the collaboration of everyone, and that was a growth for us therapists too. This fact is really very important. Through confrontation and teamwork, even against such complex issues, therapists can also grow. Okay, we have passed 3/4 of our marathon, EMDR and pandemics, 10 months of interventions. We are now taking a short break. We are going to meet at 20 to 4 with Dr. Biancaluna Renzoni. And then we are going on towards a final surprise. So the link remains active. I'll meet you back in 15 minutes from now. Thank you.